Hi, I'm Dr. Burt Webb, and I wanted to talk to you today about a subject, hormone replacement therapy, that I deal with every day. And I've been dealing with hormones for a long time, and I enjoy the subject. It's an extremely important subject. And it's interesting because some women will come to me with hormonal problems, and other women come in and I'll ask if they have any problems, and they say, no, everything's fine. And then I start talking to them and they say, well, yes, they've had a little bit of hair loss. It's starting to worry them. Their skin's dry. Their energy is less. They're having to go to Starbucks more often to get that little bit of boost in the afternoon. Their sex drive isn't as great as it used to be, but it's okay. And sometimes, you talk to them about their memory and they laugh it off and say, oh yeah, I've gotten so forgetful, I've had to write things down a few times. And so whether the woman knows that her hormones are off, or really the majority of women who come in and think that everything's fine, but when you ask them about these problems, they go, yeah, that's me. That is the area that I enjoy dealing with, is hormone replacement therapy and developing an individualized plan for each woman. What I really want to emphasize here is when a woman knows that she's having hormonal issues, let's say she's having hot flashes and her libido is less, or she doesn't know, but she's curious about what her hormone levels might be, she needs to go to someone who specializes in hormones, and I can't emphasize that enough. Most women think that gynecologists specialize in hormones, but that's not true. Our teaching is very general. It's kind of like nutrition. It's very general, and most gynecologists might go to a lecture once a year and learn about hormones. The key here is going to someone like myself who really specializes in hormone replacement. You're going to get much more information, much more accurate and much more current information. And to emphasize that, for example, when you come in and we go over your symptoms, I will draw some blood results based on your symptoms. And we have a lab that is specially dedicated to hormones that you don't find a lot of places. Most labs are very general. Ours specializes in hormone results. We get very accurate results and we get them back relatively quickly. In addition, most of the women will have an ultrasound done to evaluate a number of different aspects that aren't usually evaluated in just the general ultrasound. So we really are specializing in women who need hormones. And I think that that's another critical point, is that the staff here at our facility is really dedicated towards hormone replacement therapy. And all of our providers have had extensive education on hormone replacement therapy. The other thing that's really important to realize is that each patient will get an individualized plan. And when I'm talking to a patient, I'm going to develop a plan so that it fits into their lifestyle, whether it's creams, lozenges, gels, troches, pellets. We're going to develop a plan together that's going to match with what that patient needs and how it's going to be easiest for her. In addition, the dose is going to be the right dose. A lot of places you can get high doses and you might feel great, but you're much more likely to have side effects. We're going to talk about side effects and how to minimize those side effects and the right doses and why I think that's the right dose for you. So whether you go with a gel or a pill or a pellet, it'll be the right way for you as an individual. And our goal is going to be to get you feeling like you're 10, 20, 30 years younger, somewhere in the 30 to 40 range. I don't want you feeling like a 15-year-old. That's not always healthy. But so that you feel like you have energy, we can help with weight gain, we can help you with your hair, we can help you with your sex drive, energy, your memory, hot flashes. We can help with all those and do that in an individualized way using bioidentical hormones.